My name is Dr. Paliwal and I am Director and Head of Critical Care Services at Fortis Hospital Anandapur, Kolkata. I'll be talking on topic of palliative care in our society in India. This is one part of the medical care that we really haven't learned how to do it. We are very emotional people by and large in our country. So we don't really want to give up on our near and dear ones even when we shouldn't be. It is a fact that in spite of whatever the advancement in healthcare and critical care we have made in the last 15-20 years all over the world, people do die at the end of it. There are many diseases for which there is no solution, or sometimes diseases which can be controlled at one point in time become end of life or end stage diseases like end stage COPDs, interstitial lung diseases, lung fibrosis, or patients with really very poor heart functions because of ischemic heart disease or cardiomyopathies and so on. And of course, there are different varieties of cancers. If diagnosed late, there's not a lot that we can do for them. But we need to understand what we should able to differentiate from what is reversible and what is not reversible. And at the same time, we also have to understand that life should have certain meaning and certain quality in it. Though that quality and meaning is relative for each one of us. We may be happy with, say, able to do everything independent and jog for a kilometer, while at the other end someone would just be happy sitting on the couch and watching television with family. So that is relative. But what is important here is that there should be some element of quality in life. None of us would want to live in intensive care units or in hospital endlessly, lying on a piece of bed and not able to feel anything, not able to do anything, in a very, very dilapidated state and suffering immensely. None of us want to go out of this world that way. We all want to go out of this world in a peaceful, comfortable, and a dignified way. And that is where we are going wrong. So we need to understand what is reversible diseases, what are not reversible diseases, and when those diseases becomes terminally ill. Okay? And once we are terminally ill, we should understand that what we should do, what we should not do. People are often confuse terms with different end-of-life care, palliative care, or comfort care, or limitation of therapy. I think all these things create lots of confusion among people's minds. For me, it's just only two things. Either we are limiting therapy, limitation of therapy in different organ support point of view, or we are providing a patient palliative comfort care, which essentially means we do not provide any active care for any diseases. We only provide people which will alleviate their pain and suffering, apart from giving them food, water, and air. Okay? While at the other hand, limitation of therapy means we limit therapy just non-invasive medical therapy, or maybe give some sort of a non-invasive ventilatory support but not invasive ventilatory support, or we will give some sort of a support for blood pressure or cardiac point of view, but we won't go the whole yard, or we will not dialyze the patient, something like that. And of course, if patient arrests, then not for resuscitation. So we need to understand that death doesn't have to be painful and with lots of suffering. It can still happen without the pain and without the suffering in a dignified way. And of course, it is little, as we are growing in terms of technical side of healthcare, everybody wants to try their hand at survival and getting better, but we should realize when the end is near. And the best place to do it is probably to do it at home among your near and dear ones, rather than in hospital suffering while trying to get better, and among strangers. So best way is to do it palliative care at home. I know people at times do not have logistics to provide that end of life care or palliative care, whichever we call it. So we will require some help. While we are sick, terminally ill, I think people in general just wonder. They do not want fancy treatment. What they essentially need, they are clean, they are fed, they are comfortable, and they are not suffering by means of trying to different sort of a treatment modalities, invasive or non-invasive. That is the most important thing, and that can easily be done at home among their family members and near and dear ones. And of course, at times, there are many services which can be provided at home in that regard, so that it can happen if the logistics are difficult for family to organize. So regarding palliative care, that will be all from my end. Thank you.